Hello everyone, I'm Prachi and welcome to my channel Easy Nursing. In this video I'm going to talk about barrier methods of contraceptive. Barrier or occlusive methods are suitable for both men and women. This method prevent live sperm from meeting the ovum. The three types of barrier methods are physical methods, like condom, diaphragm, cervical cap, chemical method, like foam, cream, jelly, and combined methods. A condom is a sheath-shaped barrier device used during sexual intercourse to reduce the probability of pregnancy or a sexually transmitted infection, STI. There are both male and female condoms. A male condom is a thin film cover that is placed over erect the penis. The female condom is a soft, loose-fitting pouch with a ring on each end. One ring is inserted into the vagina to hold the female condom in place. The ring at the open end of the condom remains outside the vagina. Advantages of condom are easily available, safe, and inexpensive, easy to use and do not require medical supervision, no side effects, light, compact and disposable, provide protection against pregnancy and sexually transmitted diseases. The disadvantages of condom are it may slip off or tear during coitus due to incorrect use, skin irritation, allergic reactions to spermicide, it interferes with sexual sensations. The diaphragm and cervical cap are silicone cups that are used with a special gel or cream called spermicide, a substance that kills sperm. The diaphragm or cervical cap is inserted into the vagina and over the cervix to keep sperm from entering the uterus, meeting with and fertilizing an egg. Diaphragm is also known as Dutch cup. Advantages are person usually cannot feel the diaphragm while having intercourse and it has no risk. The disadvantages are it is not the most effective form of birth control, doesn't protect against sexually transmitted infections, easy to use incorrectly, it can slide or be pushed out of place during intercourse, it can be uncomfortable for the woman or her sexual partner, it can't be used during menstruation. Vaginal sponge combines barrier and spermicidal method to prevent conception. The advantages of vaginal sponge are it can offer pregnancy protection for up to 24 hours, it can be placed inside the vagina hours before sex and may leave it until 30 hours after. The disadvantages are it is less effective if you've given birth, it is unsafe to use during your period, it doesn't protect against sexually transmitted infections, the sponge or spermicide may irritate vagina, which can increase your risk of infection, insertion and removal can be messy or difficult. Coming to the spermicidal foam, it comes in an aerosol can and with an applicator. After shaking the can for at least 30 seconds, press the tip of the applicator on the nozzle of the can and press down. This fills the applicator with foam. While lying down, a woman should insert the applicator into the vagina a few inches and push the plunger to squirt out the foam. The foam is active immediately, so it should be inserted within 30 minutes of having sex. 2 applications may be better than 1. The applicator may be washed with soap and water, stored in a clean, dry place and used again. Contraceptive film. Vaginal contraceptive film, VCF, is a 2 by 2 inch thin sheet of film, similar to wax paper. To insert, fold it in half, then in half again, and place it on the tip of your index finger. The film should be inserted into the vagina and be placed on or near the cervix. A spermicidal film will melt into a thick gel consistency by absorbing vaginal secretions, so it will act as a barrier to immobilize sperm. VCF must be inserted at least 15 minutes before intercourse for it to completely dissolve and work effectively. Suppositories. These methods are solid forms of concentrated spermicide that melt into a foam. Inserts or suppositories are about ½ an inch long and less than ¼ inch wide. The suppository needs to be inserted in the vagina, and as close to the cervix as possible. A woman must then wait 10 to 15 minutes to allow the insert to dissolve into a foamy substance. Suppositories may be somewhat less effective than foam, cream, or gel because it is hard to know if they have fully dissolved. A new insert should be used each time you have sex. There are also foaming contraceptive tablets, which work the same way as inserts. Some women report a warm sensation in the vagina as these spermicidal tablets melt into a foam. Contraceptive cream and jelly. Contraceptive creams and gels come in different textures and tend to be less likely to drip or leak than other forms of spermicide. Twist the applicator onto the end of the tube of spermicide and fill the applicator with the cream or gel. Then, twist off the applicator and insert it into the vagina, close to the cervix, and press the plunger to release the substance. Gels and creams are most effective when used right before sex and should not be inserted more than 30 minutes before having sex.